Cannabis Advisory Board will receive updates from the medical cannabis program, review a petition, and we will also hear comments from the public in addition to scheduling for our next 2023 meeting. Pursuant to notice, this matter is being heard this 7th day of March 2023 via a web-based platform and is being recorded. The time is 9:05, and I am Stephanie Richmond, the chairperson for the Medical Cannabis Advisory Board. New Mexico Department of Health Assistant General Counsel Chris Woodward will be advising the department during this proceeding. This proceeding is being held in accordance with the Lynn and Aaron Compassionate Use Act, sections 26-2B-1 through 26-2B-7 NMSA 1978, and regulations at the NMAC Title VII, Chapter 34, Part 2. If members of the audience have not already registered for this event, please register online so that your attendance may be noted and included with the advisory board submissions to the Secretary of Health. All right, so at this time, excellent. I'd like to introduce each Medical Cannabis Advisory Board member and take a roll call in alphabetical order. After my introduction, please announce your training, specialty, and interest in the Medical Cannabis Advisory Board. Ariel Bowers.
Good morning. My name is Ariel Bowers. I am a psychiatric nurse practitioner and nurse midwife in private practice in Albuquerque. And I enjoy my professional service work with the Medical Cannabis Board because I am interested in complementary and alternative options for treatment, particularly for post-traumatic stress disorder and substance use disorders.
Thank you. If I could get assistance from the state, I don't see Mordecai Bronner or Rachel Goodman. Could you verify? Yeah, not present. Okay, thank you. Mm-hmm. Cindy Griebler.
Hi, I'm Cindy Griebler. I'm a family practice doctor. I have an integrative family medicine practice, and I've always been interested in cannabis from a medical standpoint because I've seen how well it works for some of my patients when other kinds of pharmaceuticals are just not helpful. So I'm very interested in this board.
Excellent, thank you. Courtney Marquez.
Hi, I am Courtney Marquez. I'm a physician assistant at the New Mexico Cancer Center, and I am interested in this because just seeing how many patients this has helped as far as the various products and helping reduce use of narcotics and neuropathy medications.
Thank you. Ellen Plymouth.
Hi, Alan Plymouth and Deming. After many years as a pharmacist, I switched over and became a practitioner in internal medicine and see a lot of patients with many problems, stresses, pain, sleep disorders, all related to the possible use of cannabis. And being just a part-time worker, I'm happy to be a part of this committee. Thank you.
Thank you. My name is Stephanie Richmond. I am a physician assistant in primary care, and I echo several sentiments already mentioned by my other fellow board members. I am interested in seeing how this medical cannabis is a tool for providers and patients, and also to help reduce any use of medications that are potentially very habit forming. All right, Tracy, you're next. Tracy White.
Good morning. I'm Tracy White. I'm a pharmacist clinician in Las Cruces at the Memorial Medical Center Cancer Center. I became interested in cannabis during my years in hospice care. I have background in hospice and palliative medicine. So a lot of interest, like many other colleagues, in terms of finding appropriate interventions for symptom management, decreasing pharmaceutical use, and education on dosing, product selection, et cetera.
Excellent. Thank you. Since our last meeting, we have a vacancy on the board. So thank you to Dr. J.P. Dedam for his term with the Medical Cannabis Advisory Board. His patient advocacy, insightful perspective, and participation were very much appreciated. He also served as the alternate chairperson for the Medical Cannabis Advisory Board, so this role is now vacant. So at this time, the advisory board shall elect by majority vote an alternate chairperson. The alternate chairperson shall exercise all powers and duties prescribed or delegated to them under NMAC 7.34.2.8. And nominations and self-nominations for this position will be done from the floor. So are there any nominations or self-nominations for the alternate chairperson position? No takers?
This is Ariel. I can be the alternate chairperson. I nominate myself.
Thank you. So the nomination for alternate chairperson was made by Ariel Bowers for Ariel Bowers. I second that. We will now take a roll call vote to elect Ariel Bowers as the alternate chairperson. So please answer yes or no when called upon for the election of Ariel Bowers as the alternate chairperson. Ariel Bowers.
Yes.
Cindy Griebler.
Yes.
Courtney Marquez.
Yes.
Alan Plymel.
Yes.
Stephanie Richmond, yes. Tracy White.
Yes.
Excellent. By majority vote, Ariel Bowers has been elected as alternate chairperson for the Medical Cannabis Advisory Board. Thank you. I motion to approve the minutes of our last meeting on December 6, 2022 from documentation that was provided to the board prior to this meeting. And our previous meeting was also recorded and may be viewed on the Medical Cannabis Program webpage. Is there a second for the approval of the minutes?
Second.
Second.
Thank you, Tracy. All right. And at this time, I invite the Medical Cannabis Program to update us regarding their activity and progress.
Thank you, Stephanie, and for everybody for joining us this morning. We really appreciate your service and the work that you do. I'm Dr. Dominic Zerlo. Please call me Dominic. And just a quick update on what's happening with the program is we do see our continuing trend with regard to the patient enrollment continuing to reduce each month, but this was part of the projections. We still expect this to continue for several more months before it levels out and then begins to increase. And our monthly report is put up on our website every single month. And so you can actually view those there. And I apologize, I normally would share it, but I am having issues with my sharing today. If you have noticed, my camera keeps going out and keeps coming back in. So, but if you want to see that, that is on the webpage. And other than that, the statistics are staying very stable. Same proportions with regard to gender and ethnicity and with regard to age range. We haven't really seen very many changes with that. The other thing that's happening right now is there are quite a few bills in the legislature that revolve around cannabis, and it hits pretty much every part of cannabis in New Mexico, from recreational to medical. It includes things like tax distributions to the various programs and various other items. And so this is something that we are, of course, tracking and we are following up on. We're also at various points testifying or have provided testimony for. And so as any of those bills come through, we will, of course, let the board know. Some of those bills may require changes in regulation. And so we do actually recommend that if that happens, that the board may want to meet again prior to the end of the fiscal year. And so maybe towards the latter part of May, but we'll talk about that a little bit when we get to the towards setting the next meeting date. But with the legislature still having another, what is it? I think it's another 10 or 11 days in, we're just not sure where things will be. So we just wanted to make sure that you were aware of that. If you do want to see any of the bills, you can just do a quick search on cannabis on the nmlegis.gov website, and they all pop up there. There are quite a few about packaging, like I said, tax distributions, and several other items that can affect our program and especially affect adult use. So if you want to take a look at that, please, you are more than welcome to do so. And then I'd actually like to turn it over to Gary to talk a little bit more about the Thursday webinars that he's doing and any other items.
Great. Yeah, we have continued to be holding the Thursday Cannabis Forum for providers that are certifying patients for the medical cannabis program. We've had a great number of attendees at all the meetings, a lot of new faces as well. And a lot of those new faces are coming from providers that are signing up to use the online patient portal. We've doubled the number of providers since January that are currently utilizing the portal. And any of you that are utilizing the portal, thank you. I think you'll find it really useful. And if you're not using it yet, I invite you to sign up and do so. Again, beginning April 1st, we won't be accepting any more applications in paper form. They will need to be electronic. And so that is fast approaching. But we are seeing, as I mentioned, increases in the number of providers and also patients. We're up to over 26,000 patients that are using the portal. So we're making really good gains there as well. It is streamlining the process, and patients, some patients are having access to their new cards the same day. I mean, it's really great. The electronic really is expediting things. You know, it's come off but without a hitch, rather very minimal problems. And I really want to give a shout out to all those providers that are really sort of stepping up to the plate. Sometimes the patient might not know how to navigate the electronic realm so easily, but there are providers that are helping patients in their clinics when they're seeing them actually take those steps and make those electronic progressions so that they can use the portal. So again, I commend those providers that are taking the chance to help their patients even beyond what they do for them with regards to cannabis. Thank you.
Excellent. Thank you very much for those updates. At this time, we will now proceed with consideration of a petition for the addition of insomnia as a qualifying diagnosis for medical cannabis. The applicant has been informed in advance that their petition would be heard today. The petition has been redacted to protect the confidentiality of the applicant. However, applicants were informed that they may speak directly to the board if they request to do so in advance. If any applicant has made such a request, the board will go into executive session to hear the individual applicant. Only those confidential issues related to the applicant's health status may be discussed in the closed session. If we do go into an executive session, a separate breakout meeting will be created and board members will leave this meeting to discuss in a private, non-recorded setting. I remind those presenting the petition today that this meeting is being recorded. Before you speak, please state for the record your full name and whom you represent. All advisory board members have received copies of the petition, and I ask that the presentation be kept to 3 minutes unless new information presented was not included in the original petition. If there is new information, then please limit your presentation to 10 minutes. Any petitioner who wishes to submit evidence with their petition may do so when they are recognized to present. At that time, those exhibits will be numbered and entered into the record. After the petitioner has presented, I will permit members of the board to question the petitioner. After the board has had sufficient time to discuss the petition, I will request the board move to vote on the petition being considered. The vote will be for approve, not approve, modify, or table. The board will begin by accepting Statements from petitioner applicants only. The petitioner for petition 2023-001 ad insomnia is a board member and myself. As a board member and petitioner, I am not allowed to vote on this petition as presented to the rest of the board. After the discussion, I will take a roll call vote from all other board members. Put my other hat on. My name is Stephanie, and I'm a member of the Medical Cannabis Advisory Board and have a professional interest as a medical provider in the inclusion of this diagnosis for the Lynn and Aaron Compassionate Use Act to assist patients and provide quality healthcare with medical cannabis. So as you all know, insomnia is a very common medical complaint that generates over 5 million office visits a year in the United States. And recent research has shown that later sleep timing and greater variability in sleep are associated with adverse health outcomes, such as increased risks of depression, cardiovascular disease, and developing dementia. Cannabis may have a short-term benefit on improving sleep time by reducing sleep onset latency, creating a greater ease of falling asleep and increased total sleep time. It's also been shown to improve self-reported sleep scores, and many comorbid diagnoses have already been approved under the medical cannabis laws in New Mexico, and these include anxiety, cancer, PTSD, Parkinson's, fibromyalgia, chronic pain, and sleep apnea. Cannabis does not have the same adverse reactions as conventional pharmacologic therapies, and it is less addictive than benzodiazepines and is safer in both accidental and intentional overdose to all current conventional pharmacologic treatments. And additionally, I'd also like to mention that the survey posted to the DOH website from November 2022, the survey is examination of experiences, behaviors, and outcomes of medical cannabis patients and providers in New Mexico. And it also mentions that cannabis is a commonly sought out treatment for insomnia, and patients most commonly reported sleep as the medical condition or symptom that they use cannabis for that was not previously approved by a health care provider at 54%. So I think that by aligning the research and how patients are utilizing medical cannabis, it will further create conversations between patients and their medical providers. So thank you very much for listening to my petition, and I'd like to hear from my fellow board members about their thoughts.
Hi, this is Ariel. I'm in support of this, partly because so many people that are seeking cannabis as medicine are using it for sleep, as Stephanie mentioned, and then also in terms of harm reduction and risk of lethal overdose in our state. Due to risks of like polypharmacy with opiates, benzos, and sleep medications, particularly on muscle relaxers. And given like our current climate of unfortunately like a fentanyl epidemic, I think that I think that harm reduction is necessary as part of the conversation. And as Stephanie mentioned, the cannabis use in combination with other downers is probably safer than multiple combinations of different downers, right? And so kind of thinking about like the safety of our population and the safety of my patients and the safety of, people in our state, I think that this is appropriate.
This is Alan. I agree with the above two characteristics. I have several people who have significant reduction in opiate use, elimination of benzodiazepines after having used cannabis for a while. Their symptoms of pain, chronic pain, have been reduced, and they just seem to be doing a lot better. Thank you.
This is Cindy. I agree. I think that a lot of patients are frustrated with the options that are out there for insomnia, and cannabis can be such a good option if they're choosing the right kinds of preparations. It can really be helpful. So I think that, especially for people who have early onset insomnia, it's extremely effective in helping them get to sleep and having longer sleep times.
I also agree with everyone. I think the studies you provided to Stephanie were insightful, and it did remind me of kind of that parallel with chronic pain management and decreasing opioid use. So I was also curious if there's any opportunity to study this within our state, you know, specifically maybe some of the newer indications that we've done with anxiety, and if this one goes through with the sleep. Don't know what that landscape looks like though.
One of the things that I know often comes up in these conversations is risk of cannabis use disorder, right? And what happens when people build tolerance. And I know, like, doing some literature search about, you know, insomnia and cannabis use, there is like some tolerance that builds, and that can cause like some sleep disruption, just like with any use disorder, right? And so I do think, of course, like with all medical providers, like it is, I mean, and just like with any sleep meds too, I would like to point out. And so it is important, right, to like talk to our patients and really encourage people to talk to their patients about, you know, what happens with overuse of a substance. But I think often in my experience, my patients will come back around to me and say, hey, it's not working as well, but also like I'm using more of it than I used to, and I think I need to regulate back. And that almost, I mean, I think that like having these conversations and having these trusting relationships, and then also listening to patients and helping them through, right, whatever it is that they're going through, is appropriate. And I don't think, and that's good care, right? But I don't think that risk of a use disorder is a reason to not recommend cannabis for insomnia.
Nice. Thank you for your comments. Anyone else from the board like to make any comments at this time?
I would just like to, I'm also in favor of this as well, just with experience with our patients, especially that are on, you know, high dose steroids for a variety of reasons. And this has very much helped a lot of patients with that as well. And so this,
Excellent. Thank you. All right, so I move to adopt the petition 2023-001 ad insomnia. Is there a second?
Second.
I will second.
Excellent, thank you. We will now do a roll call vote to adopt the petition, and the vote excludes myself. The vote will be for approve, not approve, modify, or table. Ariel Bowers.
Approve.
Cindy Griebler.
Approve.
Courtney Marquez.
approve.
Alan Plymel.
Approve.
Tracy White.
Approve.
Excellent. By a vote of 5 of 6 of us here, with myself abstaining, the Medical Cannabis Advisory Board has voted to approve the 2023-001 ad insomnia as another qualifying diagnosis to the New Mexico Medical Cannabis Program. Thank you all very much. Now is the public comment portion of our meeting. Individuals who have pre-registered for the meeting and have requested to make a public comment will be able to comment first and should limit speaking time to 3 minutes. If you have not previously requested to make a public comment, please click on the raised hand icon on your computer or dial *5 if you're calling in by phone. I ask for assistance from the Medical Cannabis Department with calling on speakers and for monitoring their speaking time. For those of you unable to make a public comment during the meeting, the public comment period will be open for 48 hours after the meeting. Please send all public comments to the following web address, medical.cannabis@state.nm.us. Thank you, and we look forward to hearing from you.
Okay, thank you. Our public comment period is open. And it looks like we have one comment ready to go from Ms. Caffrey. Ms. Caffrey, I will unmute you and you will have 3 minutes to give your public comment. You can unmute yourself, Ms. Caffrey, and go ahead.
All right, thank you. Can you hear me?
You sure can, yep.
Thank you. My name is Christina Caffrey. I am in-house counsel for New Mexico Top Organics Ultra Health, which has been a committed provider of medical cannabis for almost 1 decade. First, I want to point out how flimsy and insubstantial is the department's position on declining medical cannabis enrollment. All they have said is that enrollment is declining. But is a 20% decline in 1 year a reasonable expectation? Is it consistent with other states? Why is the decline so significant? What is driving the decline? Where will it bottom out? And is the decline worse in certain areas or for certain conditions? Are patients turning to illicit sources because of cost? These are all questions that surround the enrollment numbers, and these are all questions that this board should be asking, and the department staff should frankly have the answers to these questions. There is an overall lack of rigorous analysis of the enrollment decline, and that indicates that the department staff does not take this issue seriously enough. I want to comment on the survey that board members referenced. I perused that survey, and it really has no assessment of affordability or accessibility. And in that way, it fails to fulfill a mandate of the Department of Health that is required by statute. And that mandate comes from Section 26(2)(c)(4)(d) of the Cannabis Regulation Act. That section states, in consultation with qualified patients and primary caregivers, the Department of Health shall publish an annual assessment report that shall include, at a minimum, an evaluation of the affordability and accessibility of medical cannabis. I looked at that survey, nothing about affordability or accessibility. There's some survey questions asking patients about cost, but does it evaluate whether patients can actually afford or access medical cannabis in appropriate quantities? So that assessment report, at least it was done, but it fails to fulfill that statutory mandate. And the board should seriously question whether that report does fulfill the statutory mandate. And if it doesn't, it should ask the department to provide a better assessment report that includes information about affordability and accessibility. Thank you.
Thank you for your comment. There are no further comments. Thank you.
All right. Thank you very much for your time. It's always a pleasure to work with this board, and I appreciate all that you do and the work with your patients in medical cannabis. At this time, I'd like to discuss scheduling our next Medical Cannabis Advisory Board meeting. And as Dominic had mentioned earlier, due to some of the other bills that are in the legislature currently, I think that having a meeting sometime in May would be helpful, as we may need to give some review and opinions about any potential regulation changes. So does a Tuesday in May work for this group? I'd like to have an open floor discussion about this. If there's a second, we can proceed with the discussion.
Any Tuesday in May is just fine with me, and second it.
I think the latter half of May would work better for me personally.
So would the 16th or the 23rd, does anybody have a preference for either of those days?
The 23rd does not work for me. Oh wait, so wait, this is on a Thursday morning.
A Tuesday morning, Tuesday.
Oh, sorry, I'm in the wrong month. Yeah, the 23rd does not work for me. But the 16th would work.
Does that work for everybody? Okay, perfect. So I motion to convene our next meeting on May 16 at 9 o'clock. Is there a second?
A second.
Perfect. Excellent. After the second, we'll have our next meeting, May 16 at 9 o'clock at 2023 with public posting 1 month prior. It is now 9:36 on March 7, 2023, and I motion that this meeting is adjourned. Is there a second?
Second.
Excellent. Thank you all very much for your time. I appreciate your work on the board. I'll see you in May.
All right. Thank you, Stephanie.
Thank you.
Thank you, everybody. Have a good
everyone.
day.
Thanks,
you.
everyone.
Bye.
Stephanie.